Every year, 55,000 more women have a stroke than men. Because in general, women live longer than men, strokes have a more negative impact on their lives. Also, women are more likely than men to live alone when they have a stroke. They live in long-term healthcare facilities after a stroke and have more adverse effects in recovery. Dr. Lori from HCA Midwest Health is here to explain why it can be harder to recognize stroke symptoms for women and talk about prevention. Thanks so much for being here.
Thank you, Gina.
Okay, so why are there these delays in diagnosing a stroke in women?
Well, I think a large part of it has to do with women are basically caregivers for everybody else throughout their entire lives, and they kind of deny symptoms. So they might have several days of being dizzy or have headache or just not feeling themselves without ever calling their physician. They might feel generally weak and just things are off.
Okay.
Maybe a little blurred vision now and again that they're ignoring. And so a lot of it has to do with recognizing that dizziness is not normal. Just that, you know, it's not normal to have a headache.
For
it's
days.
Not for days.
Right.
It's not normal to be dizzy. It's not normal to generally feel weak or have shortness of breath.
Okay.
Or other people may notice that person's a little off. Maybe they're a little confused. Maybe they're having difficulty with word finding. Or maybe they're just a little more agitated when that's just not that person.
Right.
And those can be subtle signs of stroke. And that's where you make a phone call to your family medicine physician or your internal medicine physician, or just go to the ER. And so often women are afraid, like, well, I'll go and they'll just tell me it's nothing.
Yeah, you're
well,
fine.
let them, yes, yay, if they tell you that it's not a stroke.
You should be happy to hear that.
Yes, but let them investigate this.
Right.
Let a physician who's done a CAT scan investigate this and say, you know what, you don't have a stroke, but you have something else. But don't hesitate to access medical care. That's a big deal.
Yeah, if you are delayed with recognizing that you're having a stroke, does that impact treatment?
Well, what happens is that you're on a timeline. If you are really having a stroke, every minute is brain tissue. And so we have a 3-hour window or so when somebody really is evolving with a stroke that there can be some reversing of the injury to the brain tissue.
Okay.
So the longer you delay and the more little strokes you have or ignoring signs of a larger stroke, the more brain tissue is affected. And that then means more disability.
Okay, we touched on these briefly, but talk about some of the signs and symptoms of a stroke.
Well, some of the big signs are blurred vision, difficulty with speech, droopiness of a face, weakness of arms or hands, those types of things. Then the more subtle that women can have is just light dizziness or shortness of breath, generally feeling weak, those types of symptoms. That should be immediate access of medical care, whether that's through the EMS system or contacting your regular physician.
Okay, and what about prevention? Is there anything we can do?
Yes, understanding risk factors is the first and most important aspect of this. Know what your numbers are, know what your cholesterol is, know what your blood pressure is. Those are risk factors that this day and age can be addressed. If you have a sedentary lifestyle, start walking. If you're a little overweight, start walking anyway.
Okay.
It's all right. Those types of activities, diet, exercise, knowing your numbers are big factors in addressing the risk for stroke and helping you live a long and happy life in your own home and not having a stroke and having to go to a long-term care facility.
Yeah, nobody wants that. Some great
Nobody
information.
wants that.
Dr. Lori, thank you very much.
Thank you.
Okay, well, you can take a free stroke risk assessment online. You just have to go to hcamidwest.com, click on services, then stroke care. Along with that risk assessment, you'll also find additional resources, including a help if you need to find a neurologist.